Okay, so imagine this. You're a nursing student, right? And you're about to walk into a patient's room for the first time. Kind of nerve-wracking.
Oh, absolutely.
We've, studied your textbooks, you've practiced your skills, but are you really ready for everything? Like all those aspects of patient hygiene, it's a lot more than just like making sure someone's clean, isn't it?
You're right. There's a lot more to it.
So today we're going to do a deep dive into hygiene in nursing. And we've got some really interesting sources to work with here. We've got excerpts from a fundamental nursing textbook. We've got some research on specific hygiene practices. And get this, a reflection from a nursing student who learned some pretty powerful lessons, I think, about patient dignity.
Sounds fascinating.
Yeah. So by the end of this deep dive, hopefully you'll have a solid understanding of why hygiene is so important in nursing. You'll feel more confident providing that patient-centered care and maybe even have some aha moments to bring back to class discussions.
Love those aha moments.
Right. Okay, so let's just jump right in. Why is hygiene so important in nursing? I mean, it's more than just like keeping things clean, right?
Oh, it goes way deeper than that. I mean, it's really connected to a patient's well-being as a whole. Not just physically, but also psychologically.
Okay, so how does that work? Like, what's the link there between hygiene and well-being?
Well, think about it. If someone isn't getting proper hygiene care, their risk of infection goes way up. Something as simple as hand washing is like the first line of defense against those nasty germs.
Makes sense.
But it's not just about preventing infection either.
Right.
Hygiene also affects a patient's comfort, especially when they're dealing with an illness or an injury.
Sure.
Like a clean, dry bed can make a world of difference for someone who's in pain. And a gentle, respectful approach to hygiene can really preserve their dignity, especially when they're feeling vulnerable.
And that actually reminds me of that student's reflection we have.
Yeah.
She really highlighted that, that aspect of approaching hygiene with sensitivity.
Yeah.
Respect for that patient's dignity.
Definitely. It can have a huge impact.
Yeah.
When a patient feels clean and cared for, it can really affect their emotional state, even their recovery. It's about, acknowledging them as an individual, treating them with respect, especially when they might need help with these very personal tasks.
So it seems like hygiene really is this multifaceted thing that impacts patients on so many levels.
Mm-hmm.
But, not everyone follows the same hygiene routines.
That's true.
So what are some of those factors that influence these practices? Why is that?
That is a really great question, and it's something that, all nurses need to be super aware of. It's easy to just assume that everyone approaches hygiene the same way, but in reality, there's so much variation. It really comes down to two main categories: individual factors and health-related factors.
Okay, can you break those down for us? Starting with those individual variations, how do people differ?
All right. So first, you have to think about a patient's cultural background.
Okay.
Some cultures really emphasize daily bathing, while others, might have different norms. Religion can also play a big role.
Makes sense.
Think about things like ritual washings or even modesty concerns. And then there's, those socioeconomic factors that come into play.
Right.
Someone who's struggling financially might not have access to basic resources, like even running water or soap.
That's a really good point, and it kind of emphasizes, what we were talking about earlier, like assessing each patient individually, right?
For sure.
Yeah, not just, applying this like one standard set of rules.
Exactly. And then, on top of all that, you have to consider their developmental level.
Oh, right.
And infants' hygiene needs are totally different from a teenager's.
Of course.
And teenagers, they have different concerns compared to older adults.
Okay, so we've got culture, religion, socioeconomic status, developmental level, all playing a part in individual hygiene.
Mm-hmm.
What about those health-related factors you mentioned? How do those impact things?
Well, health-related factors can really affect a patient's ability to maintain their normal hygiene routine.
Okay.
I mean, imagine like if someone's acutely ill, they might be too weak or just too nauseous or in pain to even think about hygiene.
Yeah.
Or consider a patient with a chronic illness like diabetes.
Okay.
Meticulous skincare is like essential in that case to prevent complications.
Yeah.
And even something as simple as being hospitalized can disrupt hygiene routines.
I can see how that would happen.
You've got patients with limited mobility, patients hooked up to IVs, monitors. Some people just feel uncomfortable or embarrassed needing help.
Right. And that's where a nurse's role is so important. Understanding those individual needs.
Absolutely.
And then providing that care that's both safe, but also compassionate.
It really is about meeting the patient where they are, helping them maintain their hygiene in a way that preserves their dignity,
Yeah.
and of course, promoting their well-being.
Okay, so we've established why hygiene is so important and all those individual factors that come into play.
Mm-hmm.
But let's get a little more practical now.
Yeah.
What are those key areas that nurses really need to know about?
So I want you to picture yourself doing a head-to-toe assessment, but with hygiene at the front of your mind.
Okay, I like it.
So first up, oral care. We're talking teeth, gums, tongue, lips, even dentures. Every part plays a role in overall health.
Yeah, it's easy to kind of forget those details when you're thinking big picture, but I'm sure neglecting them can have, like a domino effect on their well-being.
Oh, for sure. Think about a patient who's really sick or has a compromised immune system.
Okay.
Poor oral hygiene can actually increase their risk of pneumonia and even other, systemic infections.
Wow, I didn't realize it was that connected.
It's a bigger deal than you think.
Yeah. It's not just about fresh breath or anything.
Right.
It's about preventing those complications.
Exactly. And it's fascinating. There are so many nuances even within oral care.
Really?
Like, did you know that certain mouthwashes can actually reduce plaque and gingivitis? But others, especially those with alcohol, can actually dry out the mouth, which is a common problem for patients who are hospitalized.
Oh, interesting. So choosing the right products is key there. Okay, so we've tackled oral care.
Mm-hmm.
What about the skin?
Yeah.
That's our body's first line of defense, right?
Absolutely. And skincare is huge in nursing.
Yeah.
Especially when you think about how much our skin changes as we age.
Oh, right.
Aging leads to thinner, drier skin, so that makes older adults more susceptible to injuries and infections.
Okay.
And then you've got those common issues like, dry skin, acne, pressure injuries. All those things require specific interventions.
Yeah. And I think one of our sources had some tips, like using lukewarm water instead of hot and avoiding those harsh soaps.
You got it. Those small things can make a world of difference in a patient's comfort and their overall skin health.
Awesome. So moving on to hair care. Is it really that important? I mean, beyond just, aesthetics and how it looks?
It really is. Think about a patient who's experiencing hair loss or what's called alopecia.
Okay.
That can be caused by a lot of things, medical treatments, even just stress.
Yeah.
And it can be incredibly distressing, so you have to approach hair care with sensitivity.
Yeah, you don't want to make that worse.
Exactly. And what about head lice or pediculosis?
Ooh. Yeah, not a fun topic.
Not really, but it's something nurses have to be prepared to deal with. Head lice, they're highly contagious, and they require, prompt treatment.
Yeah.
With specialized shampoos and lotions. And, even more importantly, nurses have to be really good at preventing the spread of those lice.
Yes, so infection control is key.
Super important. Now, moving on to eye, ear, and nose care.
Okay.
Each of these areas has its own little quirks,
Absolutely.
Take earwax buildup, for example. That's a common issue, especially in older adults.
Mm-hmm.
And if you don't address it, it can affect their hearing. But using those cotton swabs, those Q-tips to clean the ears, that's actually a big no-no.
Really?
Oh, yeah. They can push the wax further in and even damage the eardrum.
Wow. Okay. I did not know that.
So what you want to do is wipe the outer ear gently with a soft cloth. And then for those tougher cases, a doctor might recommend eardrops or irrigation.
Gotcha.
But those are things that require specific training.
Okay. Good to know. And what about caring for someone's eyes, especially, if they're unconscious or they can't do it themselves?
That's another really crucial skill for nurses.
Yeah.
If their eyes aren't kept moist, you can have some serious complications.
Oh, wow.
So you need to know how to clean them safely, using those sterile techniques, how to apply those lubricating drops. And even if a patient wears contact lenses, you might need to know how to remove them and store them.
It seems like there's a lot to remember for each of these areas.
There is, but it comes down to understanding the anatomy, the physiology of each area, and then applying those principles to provide safe and effective care.
This is fantastic information. I feel like I'm building a checklist in my head of all these hygiene essentials.
That's a great way to think about it.
Yeah. Okay, now one of the sources we have, it kind of got me thinking about those trickier scenarios that nurses face.
Yeah, where you have to think a little outside the box.
Exactly. The textbook answers just aren't enough.
You got it. One scenario involved a nursing student who saw a technician providing care in a way that just seemed, disrespectful to the patient. And that presents a real ethical dilemma. Like,
Right.
how do you advocate for your patient?
And you're a student.
Exactly. How do you navigate that whole, healthcare hierarchy?
It's a tough spot to be in. So what happened? What did the student do?
Well, I don't want to give away the ending just yet. I want you to think about how you would handle that situation. But it definitely highlights how important it is to find your voice as a nurse.
Right.
And to be ready to address those ethical concerns.
I'm on the edge of my seat. I definitely want to know how that turned out.
But, in nursing, you're going to run into all sorts of situations you don't expect. Like, take the case of Andrew, for instance. He's in an extended care facility. He insists he's already bathed, even though it's really clear that he needs help.
Okay, how do you even approach that without, being dismissive or disrespectful?
Well, you have to use your assessment skills and your communication techniques.
Right.
Instead of just accepting what he said, you might ask him to explain his routine, observe him for any signs that he might need help, and assess his, cognitive status, make sure he understands how important hygiene is.
So it's about finding that balance.
Always.
Between respecting his autonomy, but also making sure he's well taken care of.
Right.
It sounds like a delicate dance sometimes.
It is, for sure. And sometimes you'll need to bring in, family members or other healthcare professionals to come up with the best plan.
That makes sense. I really appreciate how you're connecting all of this back to these real-life scenarios.
That's what makes it relevant, right? We're not just talking about these abstract concepts.
Yeah. Okay, give me another one. What other tricky situations do we need to be prepared for?
All right, let's talk about Sonia. She recently had a stroke, and now she has right-sided paralysis. Her daughter is really eager to help with her care, which is great.
Yeah.
But Sonia is from a culture where modesty is extremely valued.
Okay.
And she's really embarrassed to have her daughter help with those personal hygiene tasks.
Oh, wow. That adds like a whole other layer of complexity.
It does.
So how do you navigate a situation like that?
Well, it all comes down to open communication.
Of course.
Cultural sensitivity, and collaboration.
Yeah.
The nurse needs to talk to both Sonia and her daughter, really understand where they're coming from, and find a solution that respects everyone's needs.
So what would that look like?
Maybe adapting certain techniques, finding creative ways to provide privacy.
Okay.
Maybe even suggesting other caregivers if that's what Sonia prefers.
Wow. This is great stuff. It really makes you think about the human side of nursing.
It really does.
And how important it is to treat each patient as an individual.
Couldn't have said it better myself. Hygiene in nursing, it's so much more than a list of tasks,
Right.
It's about recognizing the person.
Yeah.
And providing care that honors their dignity, their values, their preferences.
I love that. I'm so glad we're having this conversation.
Me too. But I have a feeling our listeners need a moment to process all of this.
Probably, yeah. This is a lot of great information.
So take some time to think about what we've talked about. Think about those scenarios and get ready to dive even deeper into the world of hygiene in nursing. So, coming back to those patient stories, they really drive home the point that hygiene care has to be individualized. You can't just use a cookie-cutter approach for everyone.
Yeah, absolutely.
Yeah.
And it's easy to think of it as just a checklist, like, okay, we did this, we did that.
Right.
But you really have to understand each patient's needs and what they prefer.
For sure. And that means thinking about things like their culture, their physical abilities, any health conditions they have, that might affect their skin or even their ability to participate in those hygiene tasks.
Yeah. One thing that really struck me as we were preparing for this deep dive was just how much emphasis there is on oral care.
It's pretty amazing, isn't it? It goes so much deeper than just brushing your teeth.
Right.
You have to consider the impact on the patient's overall health.
And I know we talked about this earlier, but our sources really hammered home that point that poor oral hygiene can actually increase the risk of things like pneumonia.
Oh, yeah.
And other infections.
Especially for patients who are already more vulnerable.
Right.
And it makes sense if you think about it. I mean, the mouth is like a breeding ground for bacteria, and if that gets into their bloodstream, it can travel to other parts of the body and cause all sorts of problems.
Yeah, so it's not just about having fresh breath. It's a really important part of preventing those complications.
Exactly. And if a patient can't take care of their own oral hygiene, then it's even more crucial for us as nurses to step in and make sure it's done right.
Yeah, absolutely. And what about dentures? I I was actually surprised to learn how many people rely on dentures and how important it is to keep them clean and stored properly.
It's definitely something you might not think about until you see it in a clinical setting.
Right, right.
But it's really essential knowledge for any nurse. Okay, so moving on to bathing and skincare. One of our sources really highlighted the importance of individualizing bathing practices.
Yeah, I remember that.
You know, some people might prefer a full bed bath, others might just need help with certain areas, or they might like a totally different method.
Yeah. And you have to be sensitive to that. I mean, bathing can be a very, personal thing.
Oh, absolutely.
And even uncomfortable for some patients.
Yeah. You have to find that right balance between providing the care that they need, but also respecting what they want.
And their physical limitations, too.
Right. Someone recovering from surgery, or maybe they have limited mobility.
Yeah.
They might need help getting in and out of the tub or shower.
Of course, yeah. And you also have to consider any skin conditions they have. I mean, I know we talked about how older adults have thinner, drier skin.
Mm-hmm.
So using harsh soaps can really dry them out even more.
Right, and increase that risk of skin irritation.
I think I remember reading that even just using warm water instead of really hot water can help.
Yeah, definitely. And there are those bath cloths that are pre-moistened, with the cleanser and the moisturizers already in them.
Oh, yeah, those are nice.
Those can be a really good option for people who can't handle a regular bath or shower.
Yeah, I bet those are really helpful for bedridden patients.
Absolutely. It's all about being creative and finding the right solution for each person.
So we've talked about individualizing bathing and being mindful of skin conditions.
Mm-hmm.
What about, those more serious issues? Like pressure injuries. How do you assess for those?
That's a critical part of skincare. Early detection is essential. If you can catch a pressure injury early, you can prevent a lot of complications down the road.
So you really have to be familiar with all those different stages.
Yes.
Right?
Yeah.
And know how to check for them.
Especially for those patients who are bedridden or can't move around much.
So it's about, looking for changes in their skin color, the texture, how warm it is.
Exactly. And don't forget those bony prominences like the heels, elbows, and the sacrum.
Right.
Those are the spots that are really vulnerable.
Okay, so skin assessments are really detailed. It's a lot to take in.
Oh, yeah. You got to have your eyes peeled.
Now, what about those, common skin problems, like just dry skin or acne? I mean, they might seem minor, but I'm sure they can bother patients.
Oh, absolutely. They can be really uncomfortable.
I know. I hate having dry skin. So any tips for those?
Well, for dry skin, you want to use those mild cleansers, moisturize a lot, and avoid those long, hot showers or baths.
Yeah, that makes sense. And for acne, I mean, I know people are tempted to, pick at it, but I bet that just makes it worse.
It definitely does.
So it's about educating patients on how to take care of their skin.
Exactly. And encouraging them to talk to their doctor if they have any concerns. So while we're on the topic of skin, let's switch gears for a minute and talk about hair care.
Okay.
Remember we were talking about alopecia and pediculosis earlier?
Yeah, not the most fun topics.
Not really, but important ones.
Mm.
So alopecia, that hair loss, can be really hard on patients emotionally, so you really want to be sensitive when you're doing their hair care.
Yeah, makes sense. And with head lice, it's not just about getting rid of them, but also preventing the spread.
Exactly. Infection control is key there. Wear your gloves, wash those linens and clothes in hot water.
Yeah.
You want to protect the patient and yourself. Okay, now let's tackle those often overlooked areas.
Okay.
Eye, ear, and nose care. They might seem pretty basic, but there's actually a lot more to it.
I'm ready. What do we need to know?
So first up, eye care. Our sources really stressed keeping the eyes clean and moist, especially for patients who can't do it for themselves.
And remember, we want to avoid using soap on the eyes, right?
Absolutely. Soap can be a major irritant.
Yeah.
Water or saline and a clean washcloth or a compress, that's usually enough to get them clean.
And when you're wiping, always go from the inner corner to the outer corner.
Right. Keep that debris from getting stuck in the tear duct.
Exactly. Those are good reminders. Okay, what about contact lenses? I know some patients wear those.
Yeah, and if a patient can't take them out themselves, like if they're unconscious, you might have to do it for them.
Right.
So you really need to know the right way to remove and store different types of lenses so they don't get damaged or contaminated.
Okay, I'm adding contact lens care to my list of essential skills. What about ear care?
Well, remember what we said about those cotton swabs? They're a no-go.
Right.
They can push that wax further in and even hurt the eardrum.
Yeah.
So just gently wipe the outer ear with a soft cloth.
Okay.
And if there's a lot of buildup, the doctor might recommend ear drops or irrigation, but those are things you need specific training for. Okay, last but not least, nose care.
Let's hear it.
The big thing here is to blow your nose gently with both nostrils open.
Oh, okay.
That helps prevent forcing anything up into the sinuses.
That makes sense.
And try to avoid those nose irrigations unless a doctor tells you to do it. They can be helpful for some things, but they can also be risky if you don't do them the right way.
Gotcha. So I think we've covered pretty much everything when it comes to the practical side of hygiene.
Well, I think so too. We've gone through oral care, bathing, hair care, even the nitty-gritty of those eyes, ears, and nose.
But before we finish up this deep dive, there's one more important topic we need to touch on, and that's the environment.
You mean like making sure the patient's room is clean and safe?
Exactly.
Yeah.
We've talked a lot about how hygiene affects the patient directly, but their surroundings matter too.
Okay, I like that. So let's imagine we're patients in a hospital room. What are some things that would make you feel comfortable and safe?
Well, I mean, first of all, the room has to be clean. I don't want to be surrounded by clutter or dirty laundry or bad smells.
Right, and those are all things that we as nurses can control.
Right, yeah.
Our sources talked about how important good ventilation is.
Yeah.
You know, to get rid of odors and prevent those germs from spreading. It's about emptying those bedpans and urinals right away, getting rid of soiled dressings properly, taking out the trash regularly.
Yeah, it sounds so simple, but I bet it's easy to forget those things when you're busy with other stuff.
Oh, it definitely happens.
Yeah.
But those little things make a huge difference to the patient.
Right, right. And it's not just about being clean. It's also about those little touches that make it nice, like using a room deodorizer or adjusting the temperature so the patient's comfortable.
Oh, yeah, that's a great point.
Yeah.
It's about making the room physically and mentally comfortable.
Exactly. And another big part of that is minimizing noise and distractions, especially when they're trying to rest.
Oh, I know. Those hospital rooms can get pretty noisy.
Right. So dimming the lights, keeping conversations quiet, just being mindful of those noise levels in general.
You got it. It's about creating a peaceful environment.
Okay, now let's talk about the bed. I mean, it's not just a place to sleep, it's where patients spend most of their time.
Oh, absolutely. And that's why it has to be clean, comfortable, and safe.
I know our textbook went into all those different types of hospital beds and mattresses.
Yeah.
It was actually pretty interesting.
There are so many different options.
Like some of them have adjustable width, lighted side rails, even built-in USB ports.
Yeah, no, it's amazing how technology is changing things.
Yeah. But even with all the fancy stuff, you still have to know the basics of making a bed,
Right.
whether it's occupied or unoccupied.
Absolutely. The textbook had some great step-by-step instructions for that.
Yeah, and it really emphasized using proper body mechanics, making sure there are no wrinkles in the sheets, and keeping that patient safe the whole time.
And of course, following all those infection control rules.
Right.
You know, wearing gloves when you're handling dirty linens, disposing of them properly.
Right, right. So it's all about creating that clean, safe, and comfortable environment that helps them heal and feel better.
Couldn't have said it better myself.
This deep dive has been amazing. I feel like I've learned so much about all the different aspects of hygiene in nursing.
Me too. It's really been eye-opening. We've talked about individualizing care, creating that healing environment, and now we're ready to tackle those tougher situations.
Yeah, those ethical dilemmas that come up.
Exactly. So get ready for part 3, where we delve into those tricky scenarios that nurses often face when it comes to hygiene.
I'm ready. Welcome back. We've covered so much in this deep dive already. You know, all those foundational principles of hygiene, the importance of individualizing care, creating that therapeutic environment. But now, get ready because we're tackling some of the toughest parts of hygiene in nursing. You know, those situations where the textbook answers just aren't enough.
Exactly. We're going beyond those basic procedures and really diving into the ethical dilemmas that pop up in real-life practice. Remember that nursing student's reflection we talked about?
Oh, yeah.
Where she saw a technician providing care that just didn't seem right?
I remember that. It really made me think about like our ethical responsibility as nurses to be advocates for our patients.
Absolutely.
Especially with something as personal as hygiene.
Yeah, hygiene care, you know, it involves those really intimate tasks, and it's easy to accidentally cross those boundaries.
Right.
Or violate a patient's dignity if you're not super careful.
So it's about like finding that balance providing the care they need, but also respecting their preferences.
Yeah, and that can be really tricky sometimes.
For sure. So what do you do? Like, let's say you have a patient who just refuses to bathe.
Oh, okay.
They're adamant about it,
Mm-hmm.
even though it's been days and you're seeing signs of skin breakdown.
That's a tough one. You want to respect their autonomy, their right to say no to treatment, but you're also worried about their health.
Right, exactly. It's like, how do you even start to deal with that?
Well, I think the first step is open communication. Really trying to understand why they're refusing care. Are they scared, embarrassed? Do they have cultural or religious beliefs that are influencing their choices?
So it's more than just telling them they need to bathe.
Right.
It's understanding where they're coming from.
Yeah, you got to get to the root of it.
Okay.
Yeah.
And then once you understand their perspective,
then you can start to adjust your approach. So maybe you educate them about the risks.
Okay.
Or you explore different bathing methods that they might be more okay with.
Well,
or you involve their family or other, members of the healthcare team.
Okay. So you try all that and they still say no.
Then it becomes about respecting their wishes while also documenting everything you've done,
Right.
And you keep monitoring them closely.
Okay. So good communication, having a care plan that's individualized and good documentation are really key here.
Mm-hmm.
What other ethically tricky situations might our listeners run into with hygiene?
Well, think about those situations where a patient can't really make informed decisions about their hygiene. Maybe because of cognitive impairment or they're in an altered mental state.
So like a patient with dementia or someone who's sedated.
Exactly. In those cases, it's about advocating for what's best for them.
Right.
But ideally, you still want to involve their family.
Okay.
Or whoever makes decisions for them whenever you can.
Yeah, and making sure those hygiene needs are met in the way that preserves their dignity.
Right. You want to keep them comfortable.
Okay, and what about, sometimes a patient's practices might clash with infection control measures?
Oh, yeah, for sure.
Like what if they refuse to take off their jewelry before surgery?
Okay.
Or they want to share their personal care stuff with other people?
That definitely happens. And in those cases, it's about clearly explaining the reasons behind those policies,
Right.
but doing it respectfully and then trying to find a compromise.
Okay, yeah. This has been eye-opening.
Mm-hmm.
It really shows that hygiene in nursing isn't just about following the rules.
It's so much more than that.
Yeah. It's about, critical thinking,
Mm-hmm.
making those ethical decisions, being an advocate for your patients in a holistic way.
I couldn't have said it better myself. We've gone over a lot in this deep dive.
We have.
But this is really just the start of your journey.
Yeah.
You're going to learn so much more as you go face new challenges.
For sure. So what advice would you give to our listeners as they continue learning and dealing with all these complex situations?
I'd say stay curious, ask lots of questions,
Okay.
and never be afraid to ask for help from, more experienced nurses. You're not in this alone.
That's such great advice. And speaking of not being alone, we want to hear from you, our listeners. What did you think of this deep dive?
Yeah, what stood out to you?
What are you still thinking about? Share your thoughts with us.
Maybe even start a discussion in your next class.
Or connect with other nursing students online. Let's keep this conversation going. And that wraps up our deep dive into the world of hygiene in nursing.
It's been a great one.
It has. Until next time, keep learning, keep growing, and keep providing that amazing, compassionate, patient-centered care.